Thank you all. I did want to let you know that we are meeting outside because we've changed our visitor policy and we're tightening up who's coming in and out of the hospital right now to keep our patients and staff as safe as possible. So thank you for doing that. On Tuesday, we admitted a patient through our emergency department for concern of COVID virus, and it was a well-coordinated effort. The patient had called his primary care doc, followed our current procedure of calling infectious disease, who agreed the patient should come to the ED. He was brought in by ambulance. The ambulance crew followed all procedures to keep themselves safe. The patient was seen in our ED and determined he needed admission to the hospital. The coronavirus test was sent to the state lab. The patient was appropriately admitted to the hospital in isolation. And late yesterday afternoon, the test came back from the state of Vermont. The patient is a presumed positive. At this point, all testing that's presumed positive goes on to the CDC for follow-up. That has occurred, but the patient, we do believe, does have coronavirus and is being cared for that issue right now. We've been preparing for our first case of coronavirus for weeks. Our team is well prepared. We have strong plans in place. We've been modifying those plans daily as the situation changes, following the CDC guidelines, and working hard with our network affiliate partners, the City of Burlington, the State of Vermont, and the CDC. So we are prepared to take care of more patients as they present, and we are modifying our policies as appropriate for where we are within this epidemic. Thank you. I'm going to turn over to Dr. Brumstead for further comments from the network.
Good afternoon. Thank you all for coming. Getting information out to folks in the region is critically important, and so you and the press corps are a key component of all of our strategies. I really want to thank every single one of our employees, as Dr. Leffler said, for their contributions during this challenging time. I am so grateful for the effort, the extra effort that they have all put in, and I'm so proud to be a member of that healthcare community. As the healthcare delivery system for the region, this is what we do, and again, as Dr. Leffler said, we are prepared. Our thoughts are with the patient that's here at the UVM Medical Center, their family, and with all across our region that are impacted by this pandemic. As a healthcare organization, we're fully aware that we're the last line of defense, and our workforce must be protected to ensure we are safe and healthy to care for our patients and folks in the region. We're working directly with the Departments of Health in both New York and in Vermont, and we're closely following the CDC guidelines for all aspects of our response to this pandemic. We've instituted, for instance, for an example, we've instituted travel and meeting policies as an organization to protect employees and the public to the extent possible. We know that one of the most effective ways to reduce the spread of the virus is what is being called through the CDC social distancing. In lay terms, what does that mean? It's pretty common sense, but it means that we should be staying approximately 6 feet apart from each other. We shouldn't be meeting in crowded, small rooms. Therefore, that's why we're out here in the glorious spring weather. We really believe that the social distancing and limiting the size of gatherings really is a critical element at this point to limit the spread. We've implemented some specific measures to facilitate social distancing. We will not have meetings within the UVM Health Network with employees of 25 or more in one place. And we've worked hard to use video conferencing and the good old telephone to try and connect our people so that we can make the management decisions and the board decisions that are necessary to move forward in these challenging times. We're eliminating travel for work and discouraging personal travel. That's very consistent with what the CDC is talking about. And additionally, we've revised our UVM Health Network visitation policy that will be implemented later today for network hospitals in Vermont and New York. And again, at a network level, we're trying to bring consistency so that those interacting with any of our healthcare organizations will be getting the same message, the same directions, again, to the extent possible. As you know, things are moving incredibly quickly. And we're, as Dr. Leffler said, continually monitoring the situation as it evolves. The CDC and from the Departments of Health, information is changing almost on a moment-to-moment basis, and we are plugged into that. So undoubtedly, we'll be back in front of you. We'll be adding recommendations, modifying what we're bringing out, which is today the best thing to do, but tomorrow we may have more information and we will modify that for our folks. So again, I want to thank you for your efforts. You are a critical link in getting this type of information out to the public, along with the websites at the CDC, website of the Department of Health. For our healthcare organizations, people can go online and find information. And with that, I'm going to open this up to questions, and I'll serve as MC. I'm definitely not going to answer every question. Let's just start right here and go across.
You mentioned the visitation policy is expanded to the entire network. For people who may not know what that visitation policy is, can you explain to anybody who may be listening or watching what the visitation policies are now?
I'm going to turn to Dawn LeBaron, who's the head of our incident command. I want to say that there are all sorts of what-ifs in a visitation policy, so I'm going to ask Dawn if she could just hit a couple of high points. Overall, we're trying to limit to only the essential, the people that come in and out of the hospital setting and are exposed to people who are working here. But Dawn, do you have some comments?
Thank you, John. And I would reiterate that the purpose of this is to serve in our role as the last line of defense. So we know the value of patient and family-centered care and do believe strongly that that is part of our care delivery. With that said, we're going to reduce the number of people that are permitted to come in with the patient, for example. So, now we have larger numbers of folks that might come in with an individual, and we're going to reduce that down to 2. There are a couple of other examples, as was mentioned. Large meetings are going to be discouraged. Vendors that don't need to be here, that don't have a critical need to be here, will also be part of that. What we're doing is appealing to people to self-police this. We're going to ask people to do this on their own to begin, and then we will ratchet up our controls a little bit as the situation changes and we learn more about what the impact is.
So let's just go right along. You were next.
Our newsroom has gotten several questions from people in northern New York who are just wondering what to do if they want to go to CVPH to get tested. Do you have advice on what they should do?
They should follow the same advice, which is to call their primary care office first and have a conversation there. What we really want to get out there as far as a message is, unless you're acutely ill and in distress, we want you to call first so that we can make sure that we're prepared for you coming, so that we can have our workers or the EMTs or the people in a clinic not exposed by you coming and asking a question. We want to be prepared, so call first. And the same thing at CVPH in Plattsburgh. Call your primary care office, we put out the protocols, and they'll be able to hook you into the system.
What about people who don't have a primary care?
What did we set up?
So if you don't have primary care and you were relatively well but concerned, you go to urgent care as of today, and you tell them of your concern, and then we have mechanisms to screen people at all different entrances to our system right now, but that would probably be the best mechanism. But I do want to make sure people understand, at this point, if you don't have clear travel history to high-risk areas, clear exposure to a patient that we know has it, it's unlikely you'll be tested just as a walk-up. We have a very robust process using our primary care docs and our infectious disease docs to pick who should be tested right now. That will change as the number of people in Vermont grows, but that's how we're doing it now. So I do want to warn people, just going to urgent care, you're unlikely to get a test just because of simple concern about being in the market or something. But if you have a true exposure and don't have access to primary care, that would be the portal to go to.
This is really just such an important point. Maybe Dr. Tim Leahy, who's one of our infectious disease doctors, could reiterate some of that or embellish.
I think one of the key messages we want to make sure people get is that we know that the number of cases is likely to grow, and we want to make sure we are there to help the people who need it the most. So somebody is home with the sniffles and feeling kind of tired and not great, but otherwise safe at home, it is better for them to stay home so that the vulnerable, elderly, immunocompromised people who we know are most at risk for this can come in, and they will have physicians and nurses who are ready and capable of taking care of them. So if somebody is highly exposed, fragile, not feeling well enough to be safe at home, of course we want them to enter our care system so we can take care of them and keep them safe. But we want to make sure that it's not just curiosity or worry that's driving it, because we have to take care of our neighbors by staying home if we're safe.
So is it fair to say that you need a doctor's orders in order to get tested at this point?
That's right. We're asking doctors and nurses to make judgments about how sick that person is and to figure out who really needs the testing and who is better served to stay home.
So to that point about testing protocol, we've been in touch with a family who they've traveled to a country that has the disease. They've also been in contact with someone who's tested positive for the disease. Their primary care physician wants them to get tested. They asked UVM to get tested. UVM has said talk to the health department. The health department says talk to UVM, and they're kind of in this catch-22. Why aren't they getting tested? Like what gives there?
The way to think about this is that early as the epidemic has evolved, what deserves a test has been changing. But now we have testing protocols that are disseminated across the network to the primary care docs, to the Department of Health. Everybody agrees on the same rules for testing, which is that if you have travel to an area that is a hot spot, Italy, Iran, South Korea, China, and you have symptoms that are concerning, sufficiently concerning to make it so that you really need care, then you can be tested. Or if you are really fragile and have an unexplained, very severe respiratory illness, then you can get tested. And so for somebody who fits into those categories, they should reach out to their physician and get tested. And if somebody thinks they might, but they call in and they realize from their physician that they really don't quite meet the criteria, well then that's good news.
And if their physician says, I think you should get tested, and UVM in this case has said, you should talk to the health, that's the situation that we've encountered right now with this family. I mean, their physician wants them to get tested, they can't seem to get it at UVM because UVM is saying talk to the health department is saying talk to UVM.
Physicians who want their patients to be tested now that we have the ability to test as many people as we need to can be tested.
Learn more about this patient. I mean, were they active in the community? Where did they travel? And we have a lot of people concerned that they're frequently public spaces here in the Chittenden County area.
So I want to remind people we are bound by federal law and what we can tell you. We are allowed to tell you the person's a Chittenden County resident and they're in their 70s. We really can't tell you much more, but you should know the Department of Health is doing an extensive trace right now everywhere they've been, and to the extent possible, the potential exposures to others.
Are you putting more people at risk if they were going to the gym or going to a restaurant and with dozens of people, and people don't know that right now?
Once again, we are bound by federal law, and we're going to uphold our obligation to patient privacy, but you should know the Department of Health is working very hard on this right now. There are few enough people in the state of Vermont right now where they can do extensive traces, and so they are hard at work at that right now.
Is there an expected timetable when we'll know more information?
The Department of Health is coordinating that as well.
How's he doing back there?
He right now is in our intensive care unit in isolation.
Can you give one of those 3 conditions that you can use?
I'm sorry?
There are like 3 levels of conditions that you sometimes will give out on patients' conditions.
He is critical right now.
And as far as the space is concerned that you've asked us to keep, 6 feet, would you recommend that event spaces in the area, like the Flynn Theater, Higher Ground, these kinds of event spaces, cancel their upcoming events?
I think as a state, we have to grapple in the next couple of days with how much of a response we're going to have. It's clear that coronavirus is in Vermont now. We knew it was coming because it's been surrounding us for a little while. And I think we're going to be looking to our leadership from the Department of Health, the government, UVM Health Network, to really make a decision on what next steps we're going to take.
I'll step out on that one and really go back to what I said about common sense and social distancing and 6 feet apart. And in your healthcare delivery system, we're limiting our meetings to 25 people in big rooms. We're maximizing our use of telephones and video. And I'll go out there and say that that social distancing as a basic way to limit spread should go to all venues, and that we should strongly consider not holding events in those types of spaces.
Did this person have any pre-existing conditions? Are they medically vulnerable? We always talk about the pre-existing conditions.
Again, what Dr. Leffler said, we're bound by HIPAA regulations, and we really just can't give that information out. And the Department of Health really is tracking down the contacts and any follow-up that needs to be done.
So what advice do you give to Chittenden County residents or anybody that's been in the Chittenden County area?
Same advice we're giving to everybody in the North Country, and anybody will listen, and the same advice that is being put out there by the CDC and every Department of Health of every state in this country. Wash your hands. Sing happy birthday twice or a slow ABC while you're washing your hands with warm water and soap. Avoid close contact and being in crowded rooms with lots of other people. If you yourself are feeling ill, you have the sniffles, cough, sneeze, stay at home. And if you see somebody who's coughing and sneezing, stay away. I mean, I have a grandmother, a mother, and lots of other relatives, most of them women, who have advised me the same for my entire 60 plus years. And so it's common sense, and that's what we're recommending.
It seems as if you guys are using your test kits kind of sparingly. Are you concerned about the amount that are available to you guys?
You want to talk about the testing?
Early on in the COVID epidemic, there were really limited numbers of tests, and so it was really important to use them sparingly. Now we have much better availability, and the availability is improving every day. And so we have less of a need to be super sparing with the test kits, but we still want to be really strategic about how we use them for other reasons. So you can imagine one has to do with keeping the healthcare system busy. We want to make sure that the doctors in the emergency room are free to be able to provide care to the people who are most fragile and most sick, and not occupied with lots of work of people who really may not need testing. Similarly, if somebody comes in with coronavirus infection, they could spread the disease to the clinician who's testing them, to somebody else who's in the lobby, and we don't want to take that risk. Even though we have precautions to protect people from it, we don't want to take even that really, really small risk if the testing itself is not super necessary. So we have protocols in place to make sure we know, does that person really seem likely to need it? Are they sick enough to need the help? And then we can get them into the care.
Do you have any quantity that you could give on how many tests you have available or something to get a sense of that?
I can give you rough numbers that the Vermont Department of Health released yesterday, knowing that every day they go out of date pretty quickly. But they reported that they had 215 patients who were being monitored for COVID disease, and then they had 69 negative tests. At the time that they reported those data, they reported one COVID-19 case in Vermont, and we already know that there are 2. So every day those numbers are going to go out, and we expect that they'll probably change more and more quickly.
How many samples are you collecting? Sending to the lab?
We have the capacity to do dozens and dozens of tests every day, and that capacity is changing every day. And so giving you a precise number at this time today would be out of date in about 15 minutes. And so I would just say more and more tests are being done, and the people who need to be tested can get tested.
Any plans for drive-up?
Yes, we are making plans to make it possible to have testing done entirely outside of our healthcare facilities. We already have separate pathways within our healthcare facilities to sort of segregate it from the ordinary work that is happening, and that's going to progress, and we will let people know when that kind of testing is possible.
Do you have a rough timeline? Do you have a minute?
Not yet, but we'll let you know.
You said outside healthcare facilities. You didn't specifically say drive-up testing. So what exactly are you planning?
Yeah, we'll let you know when we can give you some firm details.
And while we're here in the midst of flu season, do you guys have any concern about the capacity that you have to house patients who come in and need care?
So that leads to a great question. If you have not got your flu shot yet, please get it. It's not too late. There are still flu clinics. It's important. People who get the flu shot and don't get flu will open up capacity for other patients to get treated. Right now today, we have adequate capacity to care for everyone who needs our services. We have special rooms set aside for COVID-19 patients in our intensive care units and on the floor, and we're adjusting daily as we get more patients. We're getting some rule-out patients and otherwise. So today, we're in good shape, and once again, it is a fluid situation, and so we're adjusting each day. So the question about what the community should do, I just wanted to add, all of us should be very confident. There are other cases out in our community right now. We know that very sick people with COVID are ending up in the hospital, but 80% of people get mild illness. So knowing where one very sick person traveled isn't actually that helpful. You should assume when you're going out and about in public right now that you could be being exposed, and you should take all appropriate precautions that Dr. Brumstead outlined, because it's out there broader than just the 2 people that are currently in the hospital.
Going off of that, can you just talk briefly about the illness? It's airborne, how long it stays on surfaces, just kind of that stuff.
Yeah, that's a hard question.
The ED doctor wants to do it.
Can you ask your question again?
Just about the illness, the incubation period, how long it stays on surfaces, it's airborne, that kind of stuff.
So we are learning more about the answers to your questions as we go, but we have a little bit of information. We think that the incubation time for the illness is a little bit under a week, and people tend to stay sick once they are sick for a week or 2. About 80% of people do have mild disease. Most of the remainder are sick, but need oxygen and are okay. And about 1% of cases need to have their breathing supported with a mechanical ventilator. We are certain that coronavirus is spread through the air. If I cough or sneeze, it can spread it. And we suspect that probably when I cough or sneeze and it gets on a surface, that somebody who touches it could get it on their hands and touch their face and get it. But we're still learning more about the details about exactly how long it can survive on a surface, exactly how long it stays in the air. Papers are just being published about that today, and we're seeing how they do in peer review.
You see a lot of people show up requesting testing.
We are. We're getting lots and lots of calls at our primary care offices, lots of visits at their offices, at the emergency room, and we are handling the clinical load, but we're also keeping a close eye on how busy it's keeping us and making sure that we can still take good care of the people who really need it the most.
What about the staff at the hospital? Now that you have one confirmed case here and probably more, what steps are you taking to protect your staff?
First thing I want to say is our staff has done an amazing job with this patient. They've done extremely good work around protecting themselves with protective equipment. Putting it on and off is very important, and so we are protecting our staff. It's critically important for us to have a workforce right now that's here and able to take care of these patients. So some of the changes that we're making around meeting size, around visitor policies, part of that work is to make sure that we have people here and able to care for patients who need us. We're building many different care plans right now for how we would manage in different phases of this crisis if we get many more sick people. So we're hard at work at determining that. But right now we have adequate staff. They're extremely well trained and they're ready for what comes in.
in terms of supplies for them, like gowns, masks?
So we have supply chain for the network. They're updating our supplies every day. They're hard at work getting additional supplies. And as of today, we have enough supplies of everything. We're being very cautious with our supplies to make sure we have adequate stores, but we're in good shape right now.
Are there any more potential cases inside the hospital right now?
We have been ruling out other people.
How many people are being tested as we speak? Are we waiting test results?
Yes, there's several others.
No exact number?
There's 2 others.
Thank you.
A lot of people are taking a look at this and seeing a lot of people quote risk factors for the disease for people in their 60s and older, and people with other risk factors. In Albany, New York this morning, the 2 people that were confirmed with COVID-19, one is in their 20s and one is in their 30s. Has the media and the news about COVID-19 and the risk being people who are older perhaps compromise some of the younger generation at this point?
Well, we have scientific data that shows that your risk of having a severe outcome markedly increases above the age of 60. It's the 60s, the 70s, and the 80s, the risk of a bad outcome goes up markedly. There is still some risk for younger people, just like many other illnesses, just like influenza does cause severe outcomes to young people. So if enough people in the United States get COVID-19, younger people will die from it and get very, very sick. But the risk is higher for older people.
Can you talk a little bit about the training that custodians, dietitians, people who go into hospital rooms have received to prevent the spread within the hospital?
The first thing you should know is that the hospital for many years has taken care of people with all kinds of infectious diseases. We've also prepared extensively for other outbreaks like H1N1, SARS, and Ebola. So at baseline, we have staff that are extremely competent in cleaning rooms, spaces, and protecting themselves and their other patients. As we learn what's necessary to protect our providers for COVID, we did some specific training around that so people would understand that, and we were very careful in our training to remind them exactly the safest way to put the gear on and take it off. To learn other sites, people were making some mistakes in that, which was causing people to be exposed. So we've done extensive training of our staff. There's ongoing updates on a daily basis. There's more fit testing this morning. So we're actively making sure that our staff knows how to keep themselves and their patients safe.
And is there a plan in place? Say there are custodians who have to self-isolate for that 2-week period. Is there a plan to have extra help come in?
So we stood up our formal incident command structure yesterday, which is what you stand up in the time of a disaster or something like this. And they are literally planning for every possible scenario. Their eyes really focused on what it looks like today and tomorrow. But there's also teams that are thinking about, what if we have many more cases? What if more of our workforce has illness or has to be at home? How will we manage cleaning our spaces? That's all being addressed.
How many isolation rooms do you have right now?
We know that we have 4 that we're using on McClure 6, and we have 2 in our medical intensive care unit. So we have 6 rooms right now that are set up for specifically to manage coronavirus patients, but we have more capacity if we needed it.
And yeah, because I mean, 6 doesn't seem like a lot, seeing the number, like just sort of guessing the numbers that we might be seeing.
So what you should know is we've been in daily communication with our network partners. There are other hospitals in our network in the state of Vermont that could also and will likely be managing some of these patients. I had a phone call with Dartmouth on Monday to make sure our response was coordinated with them for sicker patients who might need tertiary care. And I know Dartmouth's working also with the VA, who also has a number of negative pressure rooms, what we're trying to use right now. But to Dr. Leahy's point, as we know more information about this virus, we might be able to manage it in other spaces as well. So for now, we've got 6 rooms. That is meeting our needs today, and as that changes, we'll adjust.
You mentioned as we learn more about the virus, obviously this is also a medical college campus. Do you have people coming in trying to research the virus as you have the patients here?
We're not doing active research right now on coronavirus, but there is a lot of national research going on, and we do have infectious disease specialists who do all kinds of vaccine research, and so I think it's likely you might see some publishing come out of this pandemic that we're seeing from the University of Vermont. But today, we're focused on caring for the people who need it and not research.
So I'm going to jump in and say thank you all for coming. I really meant what I said. We appreciate you coming because you're a very important link in the chain to get this information out to folks in our region. So we appreciate it. And several of us will hang for a little bit if you have some other questions. So thanks for coming. Thank you.
So just come to me.